This group is comprised of Chris Burgard, Michelle Duncan, Sarah Humphrey. The joint we are assessing is the SI joint.
Hi Michelle, I'm Chris. I'm just going to be assessing your SI joint. We're just going to start off with a little bit of palpation.
We'll be
Maybe just start off on your stomach.
palpating, looking first for two landmarks.
First one being L4, so I'm just using the leg press just to find the level of L4. Is it okay if I just bring your shirt up a little bit? So L4 here. And let me know if you have any sort of tenderness.
Yep.
No. Also looking for temperature, tension, and texture. And I'm also just going to go down to the SI joint itself. Do you have any sort of tenderness?
No.
Same thing, tension, temperature, and texture. So for both landmarks, that is normal.
Next we'll be doing two rule outs. First rule out is the hip.
Okay, so you can stay as you are. You're just going to bring your knee bent there and then push your foot out. Do you have any pain?
No.
Add a little bit of overpressure. Do you have pain now?
No.
Okay. And you just go to the other side too. Oh, any pain?
No.
Okay. Any pain there?
No.
Just turn over onto your back. Alright. Just for both sides here, bring your knee up. Do you have pain?
No.
Okay, there on overpressure. And the other side with the knee up. Do you have pain? Anything on overpressure?
No.
Great.
Second rule out is the low back, which includes
Okay, so turn over.
palpation and performing joint glides to the lumbar vertebrae.
Okay. So I'm just gonna be pushing forward. Just let me know if you have any sort of pain. So I'm at the level of L4 right now.
We want to provide some lateral pressure to the spinous processes.
Can I just bring your shirt up?
Yeah.
Do you have any sort of pain or anything?
No.
This way.
Palpation of the TVPs of the lumbar vertebrae.
Any pain?
No.
Great.
Also feeling the musculature of the lumbar spine and palpating the PSIS.
Okay. So I'm on QL right now. On the erectors too. And the SI joint itself. Any tenderness? Okay. So that everything is normal for that.
Okay, the next we're going to be doing is the range of motion of the SI joint.
So turn over onto your back.
First we'll be doing the active movements of the lumbar spine.
Okay, so actually sit up. You're just going to go down. Apply a little bit of overpressure. Do you have pain?
No.
Great.
Normal lumbar flexion is 40 to 60 degrees.
Okay, so that was normal.
Next is extension. Normal is 20 to 35 degrees.
Hands on your back there, on the back. Any pain? No. No extension, or no overpressure on extension, since there's no pain, that's normal.
Next is rotation. Normal is 3 to 18 degrees.
Turn. Any pain?
No.
Okay, so one more time this way, overpressure. Any pain?
No.
That's it. Okay.
And last is lateral flexion. Normal is 15 to 20 degrees.
Overpressure. Any pain? Pain? Great. So normal for all that.
Next active range of motion is for the hip.
Okay.
First we'll be doing hip flexion, which is 120 degrees.
So knee up to your chest. Do you have pain? Overpressure.
No.
No.
Next will be adduction and abduction.
No. Okay, so this side, you're gonna bring your heel out. Do you have any pain?
No.
Just a little bit of pressure. Any pain?
No.
Okay, so that is normal. Other side. Overpressure. Abduction. So bring your heel underneath. Any pain?
No.
Overpressure. Other side. Any pain?
Normal ranges for adduction is 30 degrees. Normal range for abduction is 30 to 50.
So it was all normal for all those ranges there.
Now if she can turn over so we can do extension. Normal range of motion is 10 degrees for this.
Okay. So you're just gonna lift your knee off the table. Okay. So that's above normal. That's about 35 degrees.
Internal and external rotation will be next.
Okay. And do it bilaterally. So same thing, knee off the table. Okay. Maybe in there. Same thing. 35 degrees above normal. Internal and external rotation.
Normal range of motion for internal rotation is 30 to 40 degrees.
Okay. So that's normal. Let's just do this. Okay. Okay. Go towards me. Any pain?
Nope.
Any pain?
Nope.
Normal for that, and then heel to your way.
Normal range of motion for external rotation is 40 to 60.
Any pain there?
No.
Normal for those.
Okay, next thing is passive range of motion, of which we'll be doing the posterior gap, anterior gap test, and SI rocking.
Okay. Posterior gap. Anterior gap. This SI rocking. Is there anything? And we'll just do the other side. Pain? So there's no pain? And those are all normal?
Okay, next is
Negative.
resisted action of the lumbar spine. So first you're going to resist forward flexion.
Okay, so just sit at the edge of the table. Just don't let me through here, okay? So, that's a grade 5. Is there any pain?
No.
So painless and strong.
No.
So that's grade 5, painless and strong.
Okay, next will be resisting flexion of the hip.
Okay, so onto your back again. Don't let me move you, okay?
Abduction of the hips.
Any pain?
Adduction of the hip.
Any pain?
No.
Extension of the hip. And the abdominal obliques.
Okay, so for all of those, for the hip, grade 5, I'm just going to quickly do bilaterally. No pain? Okay, same thing, grade 5. So with this next one, you're just going to have your arms out to start, and you're just going to kind of do like a crunch, and then you turn. So this is a grade 3. She's clearing her shoulder blades off the table. You do the other side, same thing, grade 3. Across your chest, same thing. This is grade 4. And grade 5. And elbows behind. Great.
Next we'll be doing our special tests. First we'll do the caudal shear.
Okay, so turn over onto your side. So making sure that it gets ischial tuberosity here, and then placing in a caudal sort of direction here on the here. Any pain? No. Okay.
Next is cephalad shear.
Great. Now up. Anything?
Next we'll be doing neurological tests. First looking at dermatomes.
So with those special tests, those were negative. The next part for neurological testing, I'm just going to be seeing how well your skin communicates with your spine. I'm just going to be running my fingers down your legs. Just let me know if you feel more of me, less of me at any point, or if you lose me completely. All right? Just turn your head away. Are you good?
Yep. That's fine. Yep.
All right.
Next we'll be looking at myotome function, in which we'll be resisting knee flexion.
Okay. So just don't let me move your leg, okay?
Okay.
Holding that for 5 seconds.
Okay.
Looking for fatigue or weakness.
Okay, so that was strong with no weakness. Same thing, strong with no weakness there. So that's clear for that.
What grade was that?
Oh, that was a grade 5.
Okay, next we'll be looking at a reflex, testing the Achilles.
Great. So I'm just gonna go up the pant leg here if that's all right.
Yep.
I'm just gonna kind of be hitting on the back of that tendon that runs down there. We'll see if how well the reflex. One more time. Okay, that was grade 2, so that's normal. Same thing. Just relax your foot. Grade 2.
Finish up, you need to restate your findings.
Okay, so we didn't find any sort of positives as for pain or anything. That includes all the ranges, the palpation, and find anything. Special testing provoke any sort of pain. And same with our neurological testing. As for a clinical impression, in this case, Michelle, I don't see any SI joint dysfunction of sorts or any sort of pain related to it. As for treatment, we can treat really without any sort of limitations due to SI joint problem or dysfunction.
That's it.